Hi friends, welcome to EC Nurse where nursing education made easy. Sorry for the trouble. So hi friends, welcome to EC Nurse where nursing education made easy. So last classes we had discussed till unit number 2 of nutrition and dietetics. So today we are going to discuss infant and child nutrition from unit number 3. So this is unit number 3, infant and child nutrition. So let's discuss unit number 3 detailedly. So let's start guys. Yes. So we are going to discuss what is infant. So who is infant? A baby from So a baby from birth up to 1 year of age. So from the birth date to the 1 year of age, the baby is called infant. During this stage, infants are highly dependent on the caregiver for survival. So basically they'll depend on the mother for survival, growth and development. They begin to develop basic motor skills, sensory abilities and emotional attachment. So the period of birth from 1 year of age is known as infant. That period is infant. So now coming to the child. Child is a young person from 1 year to puberty around 12 years of age. So 1 to 12 years we will call them child. Yes. So this stage include toddlerhood, early childhood and middle childhood, during which the child will develop physically, cognitively, socially and also emotionally. They learn to walk, talk, interact with others and gain independence. So that is child. So this is the definition of infant and child. So let's move on to the infant and child nutrition. So that's what we need to study here, important. So infant and child nutrition involves essential feeding practices from birth through early childhood, including breastfeeding, formula feeding, complementary foods and balanced diet for their optimal growth and development or health. So for the optimal growth and development for their health, for their immunity, they need the breastfeeding, formula feeding and complementary foods along with balanced diet. So what is the feeding of a normal infant? So how the normal infant feeding? 0 to 6 months exclusive breastfeeding. So that means only breastfeeding. So the breastfeeding is here important. Provide complete nutrients and immunity. So for the 6 to 0 months babies, like 6 months babies, they need only breast milk. They will complete their nutrition and immunity through that. From 6 months to 2 years of age, here we need to start the complementary feeding for them. Complementary feeding with semi-solid or solid food alongside the breastfeeding. So continue with the breastfeeding. They need to start the solid foods for the semi-solid food or solid food for the baby from 6 months to 2 years. After 1 year, gradual transmission to family diet with balanced nutrition. So after 1 year, we can able to start what the family is having, same food we can give to the baby, but with the balanced nutrition. So this is feeding of a normal infant. Coming to the nutritional requirement of an infant. So what is the nutritional requirement of an infant? It is they need energy around 100 to 120 kilocalorie per kg per day to support their rapid growth. So their bodies, so they need 100 to 120 kilocalorie per their body weight per day they need for their energy. Protein, essential for tissue growth, about 1.5 gram per kg per day. So based on the kilogram of them, their body weight, we need to give 1.5 gram per kg per day. Carbohydrates, like primary energy source, mainly from breast milk to formula. So they will get from the primary energy sources carbohydrate, they need to get from the food. Next is fat, provides essential fatty acids like DHA, ARA for the brain and vision development. So they need fat also for their development of their brain. Next is vitamins and minerals like micro elements. So here they need iron needed for the brain development, supplemented after 6 months. So it should be started after the 6 months. Need to give the iron for the babies. And calcium, vitamin D. Calcium and vitamin D essential for the bone growth. Vitamin A supports vision and immunity immunity. Zinc that is important for immune function and growth. So this is the nutritional requirement of an infant. So they need micro and macronutrients. So what are the macronutrients? Carbohydrate, protein, fat, and micronutrients include vitamins and minerals. So coming to the factors to be considered while planning infant feeding. So what are the things we need to consider while we are planning an infant feeding? So the nutritional needs. So it should be based on the need of a baby. Ensure proper intake of essential nutrients for growth and development. Breastfeeding versus formula feeding. Choose the best feeding method based on the health and availability. Age appropriate feeding. So introduce complementary foods at 6 months while continuing the breastfeeding. And food safety and hygiene. Maintain cleanliness in food preparation and storage. Allergies and digestive readiness. Introduce new foods gradually and monitor for reaction. So slowly they need to start the food slowly. Otherwise the reactions will be there. So allergic reaction will occur. So this is the factors to be considered while planning infant feeding. Next we will see feeding of a premature infant. So what is premature infant? So the baby born without the proper weight. So or before completing the viable of pregnancy. So feeding of a premature infant, factors to be considered. So what are the things we need to consider here? Gestational age and birth weight. Determining the feeding method like parenteral tube or oral feeding. So consider or we need to find out the gestational age. How many months the mother or how many weeks the mother completed her pregnancy and what was the birth weight of the baby. So determining the feeding method like parenteral tube or oral feeding. Next is immature digestive system. Requires easily digestible and nutrient rich food. Because of their prematurity, their digestive system will be immature. It requires easily digestible and nutrient rich feeds. Breast milk or preterm formula. Fortified breast milk is preferred, but special preterm formulas may be needed. Feeding tolerance. Monitor for signs of intolerance such as vomiting or bloating. Medical conditions like consider respiratory tract infections and necrotizing enterocolitis risk. So these are the factors to be considered while planning a baby with premature birth. Coming to the nutritional requirement of a premature baby. So what are the nutritional requirement they have? Energy they need 110 to 130 kilocalorie per kg per day to support their rapid growth. Protein they need 3.5 to 4.5 kilocalorie gram per kilocalorie per day. Carbohydrate 10 to 14 gram per kg per day, and fats should be 4.8 to 6.6 gram per kg per day. So this include essential fatty acids like DHA or ARA for the brain development. Coming to the micronutrients, vitamins and minerals, they need calcium and phosphorus for their mineralization, bone mineralization, iron to prevent anemia, vitamin D to support the bone health, zinc and vitamin A for enhancing the immunity and growth. So this is the overall nutritional requirement of a premature baby. So now we will see supplementary feeding of infants. So what are the main supplementary feedings there for infants? Supplementary feeding refers to providing additional foods alongside the breast milk or formula to meet the infant's growing nutritional needs, usually starting at 6 months of age. So here what happens? Supplementary feeding means continuing the breast milk or the formula milk, we are introducing the new food to the child. So that is supplementary feeding. So what are the key considerations in supplementary feeding? Age appropriate food. So start with food like soft, mashed foods, gradually introduce a variety of textures. So with the soft foods we need to start like banana, mashed bananas or mashed potatoes. After that gradually introduce a variety of texture of foods. Nutrient rich diet include iron rich foods like mashed beans, meat, fruits, vegetables and grains. Gradual introduction. Introduce one new food at a time to monitor for allergies. So we are monitoring for allergies. For that we need to introduce one food at a time. So don't give 2-3 foods at a time. So introduce slowly to identify any risk or allergies. Hygiene and safety. Ensure proper food preparation, storage and hand washing. Discontinued breastfeeding. Breastfeeding should continue alongside supplementary feeding until at least 2 years. So this is the key considerations while considering the supplementary feeding of an infant. So now we will discuss about the advantages of supplementary feeding. So it supports growth and development, providing additional nutrients needed beyond breast milk for 6 months. After 6 months, prevents malnutrition. So through supplementary feeding, we can able to prevent the malnutrition, reduces the risk of deficiencies like iron and vitamin A deficiency, enhances immune function. Proper nutrition strengthens the immune system, promotes motor skills, helps infants develop chewing and self-feeding abilities, encourages healthy eating habits, introduce a variety of taste and texture early. So this is the advantages of supplementary feeding for infants. So coming to the method of introduction, so how we can introduce the supplementary feeding to a 6-month-old baby. So start at 6 months. Introduce small amount of soft mashed foods while continuing the breastfeed. So alongside the breastfeed, so at the 6 months start to give small amounts of soft mashed foods. Single food first. Begin with iron-rich foods like mashed vegetables, fruits or cereals. Excuse me, and introduce one food at a time. So slowly starting to give a food, so introduce one food at a time. Gradual increase. Slowly increase the food quantity, frequency and variety. So gradually, like slowly increase the quantity of food, quality and frequency as well as variety of food. Proper texture. Start with purees, then progress into mashed or finger foods as the infant grows. Monitor for allergies. Introduce potential allergies, like example, some kids will be allergic to peanuts, eggs. So one at a time and observe the reaction. So then find out which food the baby is allergic to. So this is the method of introduction. Yes, so the another important topic in this section we are going to discuss is weaning. So what is weaning? It's a gradual introduction of solid food to the baby's diet while reducing their dependence on formula milk or breast milk. So we are gradually in this weaning method, gradually the decrease of breast milk and formula milk, but adding or introduction of solid foods to the baby's diet. So that is weaning. So it refers to the gradual introduction of solid foods to the baby's diet while reducing their dependence on breast milk or formula. This transition typically begins around 6 months of age when the baby's digestive system is mature enough to handle solid food. So when at the 6 months the baby's digestive system will be mature enough to handle the solid food, then we will start to give the solid foods at the 6 months and continues until they are fully consuming a balanced diet to solid foods. So this is the definition of weaning. Now coming to the stages of weaning. Initial weaning, 6 months. So introduce pure or mashed foods like vegetables, fruits and iron-rich cereals while continuing the breast or formula feeding. Next is progressive weaning, 7 to 9 months. After 6 months, 7 to 9 months, introduce soft, mashed or lumpy foods and finger foods to encourage chewing. Advanced weaning, 9 to 12 months, 1 year of age, introduce a wide variety of food, family foods with different textures, reduce milk intake as solid become the main nutrition source. Complete weaning, from the 12 plus months, like from the 1 year, it should be complete weaning. Transition fully to solid diet with family meals and replacing the breast or formula milk with cow milk or other alternatives. So this is the stages. Initial stage, initial weaning, 6 months. Progressive weaning, 7 to 9 months. Advanced weaning, 9 to 12 months. And after 1 year, it is complete weaning. Signs a baby is ready for weaning. So what are the signs the baby will show at the time of weaning? Able to sit up with support and control head movement. So if he or she is able to sit up with head or head control is there, then that baby we can introduce weaning. Shows interest in food and tries to grab it. So whenever they see the food, they show interest and try to grab it. Can move food to back of the mouth and swallow. So they will try to move the food to the back of the mouth and try to swallow. So these are the signs a baby is ready for weaning. So what are the key weaning tips? It includes start with single ingredient pures like mashed banana, carrot. Introduce one food at a time to monitor for allergies. Offer a variety of texture to develop chewing skills. Avoid honey, whole nuts and excessive salt or sugar. So that is important. Avoid honey, whole nuts and excessive salt or sugar. So these are the key weaning tips. So now we will discuss about effects of weaning on mother and the baby. So what is the effect it is going to be happening in mother and baby? So what are the effects? So physical effects. Come to the physical effect on the baby, how it is affecting. So the nutritional changes will be there. The baby requires a balanced diet. Digestive adjustments will be there. So possible constipation may occur. Slightly increased risk of infection, less breast milk immunity. So this is on the baby physical effects. On the mother, what will happen? Breast encroachment due to milk build-up. So the mother is not feeding the baby. So there will be breast encroachment or breast enlargement will be there. And risk for mastitis from the blocked duster. So the baby is not having breast milk. It will cause risk for mastitis. So breast tissue will be inflamed. Hormonal changes causing fatigue or mood changes. So this is the effect on mother. Coming to the emotional effects, possible distress due to reduced comfort from breast milk, fresh feeding. So after 6 months, there is a reduction in the breastfeeding. So the baby will have possible distress. Increased cleanliness, fussiness and sleep disturbances will be there. Behavioral changes such as irritability we can able to see in the baby. Coming to the mother, she will have emotional sadness or sense of loss. So she will feel depressed while because his baby is not having the breast milk. Post-weaning depression due to hormonal changes. Guilt or anxiety over stopping the breastfeeding. So the mother will feel why I stopped the breastfeeding. So that guilt will be there in the mother. Coming to the tips for smooth weaning. So what are the tips for smooth weaning? In the case of baby, gradually introduce solid foods while reducing breastfeeding. Provide extra comfort and bonding time. Offer nutritious meals to ensure proper growth. For the mother, gradually decrease the feeding sections to prevent discomfort. Use cold compress and express small amount of milk to relieve encroachment. Seek emotional support from loved ones or professionals if needed. So because postpartum hemorrhage is common among the mother. So these are the effects of weaning on mother and baby. Now let's discuss about psychology of infant and child. So what are the psychology of infant and child feeding? It includes bonding and attachment. So feeding fosters emotional security and strengthens the parent-child relationship. So through breast milk, the mother and child baby's relationship is building. So that will be the parent-child relationship will be smooth and strengthening. Trust development. Responsive feeding helps infant to develop trust in caregivers. So they will start to trust the caregiver. And sensory and emotional experiences like taste, texture and meal time interactions influence a child's food preference and eating habits. So what they are having, what their taste, texture, meal time interactions, they will affect it will affect the child's food preference and eating habit. Independence and control. As children grow, self-feeding encourages autonomy and decision making. Parental influence. Caregivers' attitude, responsiveness and feeding patterns shape long-term eating behaviors. Behavioral associations. Positive feeding experience promote healthy eating, while force feeding or restrictions can lead to food aversions or emotional eating. So, forcefully, if you are force feeding or restriction, it will lead to food aversions or emotional eating. So, these are the psychology of infant and child feeding. Now we will discuss about feeding the sick child. So as a child health nurse or a pediatric nurse, how you will feed the sick child. So feeding a sick child involves special consideration to ensure proper nutrition and recovery while minimizing the discomfort or complications. So we must ensure that the baby is getting the proper nutrition and recovering from the disease condition. So importance of feeding the sick child. What are the importance here? Maintains nutritional status. Support the immune system. aids in faster recovery, prevent weight loss and malnutrition. So what are the general principles in feeding the sick child? So small frequent meals, easier to digest and more appealing. Offer favorite or familiar food to encourage eating. If the baby is having some favorite food, offer that because they have their favorite food. Ensure adequate fluids to prevent dehydration, maintain hygiene and to avoid secondary infection. So this is the important and general principles of feeding the sick child. So next is age-appropriate feeding. So infant 0 to 6 months, if the baby is sick, continue exclusive breastfeeding. If not possible, give expressed breast milk or milk for infant formula. Infants from 6 to 12 months of age, continue the breastfeed. Offer soft mashed food like porridge, mashed vegetables and fruits. Children 1 to 5 years, offer soft, easily digested foods like example, rice, soup, khichadis, banana. Avoid spicy, greasy or hard to chew foods. So this is the age-appropriate feeding in sick child. Next, nutritional guidelines. High calorie, high protein diet is tolerated. If tolerated, we can give them like example, egg, milk, pulses. Micronutrients, vitamin A, zinc, iron, supplements should be prescribed. Oral rehydration solution in case of diarrhea or vomiting. Feeding during specific illness, like in the diarrhea, the child is suffering with diarrhea. Continue feeding, give more fluid and ORS. Fever, light meals and plenty of fluids they should take. Vomiting, clear liquids, initially then gradually return to solid. Respiratory infections like small frequent infections is there, or we need to encourage small frequent meals and encourage fluids. Now, parental or caregiver role. Feed with love and patience. So the baby should be fed with love and patience. Encourage, don't force them. Monitor the signs of dehydration or worsening illness. Seek medical help if the child refuses food more than 24 hours. Nursing consideration. So what are the nursing consideration here? Assess the nutritional intake daily. Educate caregivers about proper feeding. Maintain records of fluid or food intake or output. Report any feeding difficulties to the healthcare team. Yeah. So dieting diseases of infancy and childhood. So now we will see infancy and childhood. What are the types? In the case of diarrhea, so the child is suffering with diarrhea disease. What is our goal? To prevent dehydration, to maintain the nutrition. So continue breastfeeding or formula feeding. Oral rehydration solution after every loose stool. Age appropriate should be continuing rice like rice porridge, mashed banana. Avoid carbonated drinks, sugary juices or fatty foods. So this is the main thing in the diarrheal disease. Coming to acute respiratory tract infections or infections like cold or pneumonia, goal is to maintain fluid balance and energy intake. So they should have warm fluids like soup, dal water, light porridge, easy to swallow foods to avoid choking, continue breastfeeding and small frequent meals. So this is the diet protocol in the case of acute respiratory infections. Now let's see fever. So if the baby is suffering with fever, what is our goal? Replace fluid loss, provide energy. So encourage increased fluid intake like ORS, coconut water or fruit juice. Light, high energy diet like soft khichdi, mashed potatoes, curd rice. Avoid heavy or oily foods. Coming to the protein energy malnutrition, so the child is suffering with PEM. So what will be our goal? Restore nutrition gradually. So we need to restore the nutrition gradually. High calorie, high protein diet we need to have. Give them milk, eggs, pulses, oil, nuts based on their age. Therapeutic diet like F75 and F100 in hospital setting. Frequent feeding 5 to 6 times per day they need to get the feeding. Micronutrient supplementation like vitamin A, zinc and iron. In case of lactose intolerance, so the baby is suffering with lactose intolerance, what is the food we need to give? So the goal is to avoid symptoms while ensuring the nutrition. So eliminate lactose containing food like milk and milk products should be eliminated. Use lactose free formula for the infant. Provide alternative like soy milk, rice milk based on their age appropriateness. Monitor for the nutritional deficiencies. Coming to celiac disease, the baby suffering with celiac disease, avoid gluten and ensure adequate nutrition. So they need to eliminate wheat, barley and rye, provide gluten-free cereals like rice, corn, millet, ensure adequate iron, vitamins and calcium supplements. Constipation. So the baby, it's very common in the babies and children, constipation. So what is the management or goal here? To improve the bowel movement. High fiber food diets they need to take, like fruits like papaya, pear, vegetables, whole grains. Adequate water intake. Encourage physical activity for the older children. So this is where we can manage the constipation. Next is vomiting. So if the baby is suffering with vomiting, goal is to prevent dehydration and gradually reintroducing the food. So start with clear fluids like ORS, rice water, electrolyte drinks. Gradually introduce bland foods like mashed rice, banana or toast. Avoid spicy or oily food until recovery. Next condition is anemia. So what is the goal here? To improve the iron status. So iron-rich foods we need to give them like green leafy vegetables, jaggery, egg, meat if a non-vegetarian baby. So vitamin C rich food like orange, lemon to enhance the absorption. Iron supplementation as per doctor's advice. Coming to rickets, so the baby is suffering with rickets, goal to increase calcium and vitamin D intake. So diet rich in milk, cheese, egg, yolk, fish will be provided. Exposure to sunlight, so sunlight exposure for the vitamin D and supplements if needed. Yes. So next topic we are going to discuss is malnutrition and undernutrition. So what is the definition here? Malnutrition is the condition caused by imbalance in the intake of nutrients, either too low, too much or wrong kind of nutrients. So it is the imbalance in the intake of nutrients, either it is too low, too much or the wrong kind of nutrients. Undernutrition is a type of malnutrition that results from insufficient intake of calories. So that baby is not taking sufficient food, insufficient intake of calories, protein or essential vitamins and minerals. So that's the definition of malnutrition and undernutrition. So what are the types of malnutrition? First one is undernutrition. So like wasting, low weight for the height. So based on their height, they won't have the weight, low weight for the height. Stunting, low height for age. So age appropriate height won't be there for the baby. Underweight, low weight for the age. So appropriate age for the age, there won't be weight. Micronutrient deficiencies like lack of vitamins or minerals. Example, iron, vitamin A. Overnutrition, excessive intake of nutrients. So the baby will take the excessive intake of nutrients leads to overweight, obesity, diet-related non-communicable diseases like diabetes and hypertension. So this is types of malnutrition, undernutrition or overnutrition. Causes of undernutrition. So what are the main causes of undernutrition? Inadequate food intake like poverty, poor weaning practices. Infections like diarrhea, pneumonia, measles. Poor maternal nutrition during pregnancy. Lack of breastfeeding or early weaning before 6 months of age. Lack of knowledge about balanced diet, poor sanitation and hygiene. So these are the causes of undernutrition. So coming to the signs and symptoms of undernutrition, wasting. So there limbs will be thin, reduced fat, standard growth, underweight, delayed milestones, hair changes, praise will be light colored, swollen abdomen like in the case of kwashiorkor, irritability and fatigue, frequent infection. So this is the signs of undernutrition. So the classification of protein energy malnutrition. So it is mainly divided into marasmus, kwashiorkor, marasmic kwashiorkor. So three categories: marasmus, kwashiorkor, marasmic kwashiorkor. So what is marasmus? Here what happened? Severe wasting will be there, edema, no edema will be there, very thin appearance and loss of fat or muscle. In case of kwashiorkor, their body have edema, swelling will be present in their body, moon face. So the face will be round, moon shape, fatty liver, flaky pink skin and poor appetite. In case of marasmic kwashiorkor, features of both marasmus and kwashiorkor will be present in the baby. So this is the classification of protein energy malnutrition. So protein energy malnutrition is mainly classified into three categories: marasmus, kwashiorkor, marasmic kwashiorkor. So coming to the prevention, so how we can do the prevention here? Exclusive breastfeeding for up to 6 months. So continue breastfeeding from the 0 to 6 months. Timely weaning with nutritious complementary food. So when the food weaning is starting, it should be nutrient-rich food should be started. Balanced diet with proteins, calories, vitamins and minerals should be given. Growth monitoring in under 5 clinics. So in the hospitals where under 5 clinics, they need to get the growth monitoring about their weight, height. Also, immunization and infection control. So for the national immunization schedule, give all the vaccinations and immunizations and infection control. Nutrition education for the mother. So the mother should get the nutrition education. So these are the preventive methods. Now management of undernutrition. So mild to moderate undernutrition, how we can manage? We need to give the nutritional counseling. Home-based energy dense meals should be provided. Micro-supplement, micronutrient supplements should be provided. In the case of severe acute malnutrition, therapeutic feeding should be done. F575, F100, ready-to-use therapeutic food should be given. Medical treatment for infection, hospitalization if necessary in the case of severe acute malnutrition. So what is the role of nurse in malnutrition and undernutrition? Assess growth using weight height chart. You need to use that. Identify and classify the malnutrition. Educate caregivers on nutrition and hygiene. Monitor feeding practices. Also to support rehabilitation and follow-up. So this is the role of nurse in malnutrition or undernutrition. Now coming to feeding the preschool child 3 to 6 years. If the baby is 3 to 6 years, how we need to do? So nutritional needs of a preschool children. So at this age, children experience steady growth, develop food habit and need a balanced diet for their physical, cognitive and emotional diet. So they need a balanced nutrition for cognitive, physical and emotional development at the age of 3 to 6 years. So what are the nutrients requirement here? They need calories 1200 to 1000 kilocalorie, 1600 kilocalorie per calorie. So that they need energy for active body growth. So activity and body growth they need 1200 to 1600 kilocalorie. Protein they need 1.5 to 1.2 to 1.5 gram per kg of body weight for the growth and tissue repair. Calcium 600 milligram bone and teeth development. Iron 9 to 10 mg preventing anemia, supporting the brain development. Vitamin A 600 to 400 to 600 microgram, that is to vision and immunity. Vitamin C 40 to 50 mg, that enhances iron absorption and immunity. Fluids they need 1 to 1.2 liter per day for preventing the dehydration. So this is the nutrients daily requirement and its functions. So factors to be considered when planning the diet for a 3 to 6 years baby: age and weight, activity level we need to monitor. Energetic children need more calories. Adjust quantity with the growth. So while the growth, adjust the quantity of food. Cultural and family food habits. So practice what your cultural and family food habits. Respect traditional food but ensure balance. Appetite and preferences. What their appetite and what they prefer, we need to consider that. Introduce new foods gradually. Meal frequency. So they need to get the 3 or 4 meals per day. 3 main meals plus 2 healthy snacks. So 3 main meals like breakfast, lunch and dinner. In between they need to get the 2 healthy snacks. Texture and variety should be there. Easy to chew food should be given. In meal planning or preparation to increase interest. So they'll eat what? We can add them in their meal planning, so it will create the interest and they will have that they are liking food or the food they like they will have. So this is the factors to be considered while planning the diet. So next is colorful and attractive presentation encourages eating. We need to avoid junk foods, limit sugary, salty and fried items in the food. Food safety and hygiene should be followed. Ensure clean, well-cooked meals and involve the child. So this is the factors to be considered when planning the diet. Now coming to the common problems in feeding preschoolers. So what are the common problems here?
picky eating. So they will have picky eating. What is the cause? Maybe taste preference, asserting control. So solution, offer variety and avoid force feeding. So skipping meals. Maybe why they are skipping meals? Because of distraction, irregular schedule. So maintain routine, reduce snacks before meals. So before the dinner, don't give them snacks. So they will feel hungry, so they will have the dinner. Low appetite, illness, fatigue or maybe emotional stress they have. Encourage light, frequent meals. Food jacks, like eating only one food. So that maybe the problem is behavioral phase. Continue offering other foods without pressuring them. Or next is constipation. Low fiber or fluid intake, that is the cause for constipation. So add fruits and vegetables and more fluid in their diet. Overeating or obesity, like sedentary lifestyle without any physical activities, having the food, junk food. Encourage physical activity and healthy portions should be given. Iron deficiency anemia because of poor iron intake. Include green leafy vegetables, legumes or fortified cereals. So this is the problem, its cause and solution. So the role of nurse or caregiver. Educate parents on balanced diet and portion size. So what is balanced diet and what is the portion size? Monitor growth and development. Identify and manage feeding issues early. Encourage family meals and healthy food habit. Reinforce positive feeding environment like no TV or gadgets during meals. So this is the role of nurse or caregiver. Now we will discuss about school lunch program. So what is school lunch program? It's also known as midday meal program, providing free, subsidized and nutritious food to school children during school hours to improve their health, learning capacity and school attendance. So they give the lunch to the children who is attending the school. So thereby we can able to increase the school attendance, their learning capacity will increase and their health also will increase. So this is also known as midday meal program. So what is the advantages of the school lunch program? It improves nutritional status of school children. So we can able to improve the nutritional status of the school children, increase school attendance and reduce dropout rate. So they will attend the school and their dropout rate will be low. Enhances learning ability and classroom concentration. Promotes social equality among children. So they will have togetherly in the school, they will have sit and have the same food. So they will be promoting the social equality among the children. Encourages good hygiene and healthy eating habits, providing economic supports to poor families. So these are the advantages of school lunch program. So need for school lunch program in India. So in India, why we need school lunch program? So high malnutrition rate. So India has one of the highest numbers of malnourished children in the world. So National Family Health Survey shows high rate of stunting, wasting and underweight in the children under 5 years. So that's why we need midday meals program or school lunch program in India. Socio-economic inequality. Many families cannot afford nutritious meal daily. So for poor families or poor income, low income families, they can't afford nutritious meals daily. So this program will help them. So help bridge the nutritional gap for children from low income household. Educational impact. So hunger affect concentration and memory. So a school lunch increases attendance, retention and learning outcomes. So this is the need for school lunch program in India. Next is rural and tribal needs. So children in remote or rural or tribal areas often lack access to the balanced diet. So in the tribal area, what will be the children is not getting balanced diet. So this program is lifeline in such regions. So in that particular school, if they are giving the midday meal, it will be the nutritious food will be given to the child. Public health strategy. Schools are ideal setting for health promotion and nutrition education. So from the school itself, we are starting the nutrition education. It is an ideal place to give the nutrition education and health promotion. Helps in helps in early detection of nutritional deficiencies and referral health services. So through school program, we can able to identify early malnutrition program or nutritional deficiency disorders and we can refer them to the hospital. So these are the main purpose of nutritional health programs in or the midday meal program in India. So example, midday meal scheme. So the program has example midday meal scheme in India, launched in the year of 1995, centrally sponsored scheme. So it is central government sponsored scheme. It covers children in government and government aided schools from class 1 to 8. So from the class 1 to 8, from the government schools and the government aided schools, they give the lunch through this midday meal program. What is the meal prepared? Cooked meal with specified calorie and protein content. So it should be a cooked meal with specified calorie and protein content. So what is the objective? To improve child nutrition, to increase enrollment and attendance in the school, to promote social integration. So this is the example and these are the uses. Yes. So till now this section or this chapter we have discussed unit number 3, infant and child feeding. So I hope everyone understood. So we'll meet in the next section with the next chapter. Till then, keep learning, keep growing with easiness where nursing education made easy. Thank you.